The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress HomeCare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures. I'm your host, Bob Roth, and it is March the 10th, 2017, and we're coming at you live from the Scottsdale Air Park. It's hard to believe we're already into March. March 10th is a day that is very special to me and my family. I know many of our listeners here today know my story. I got into this home care business because I was a caregiver for my mother. And today, Mom would be 81 years old, and she's been gone now 15 years, and I think about her nearly every minute of the day. And truly, it has that experience of being a caregiver really fueled my passion and my family's passion to start a home care agency so that we could care for others. And it's hard to believe that next month we'll start our 24th year, and we've been serving our community here, enabling and helping our older adult population to be able to exist as independently as they can in their home. And how do we do this? We do this by providing exceptional caregivers. We employ nearly 200 caregivers are on our roster presently. 130 to 140 are working at any given time. And they are not just caregivers. These are people that are giving spirits. They are compassionate. They want to make a difference in somebody's life. And you think about it. You think about your older adult population. And I hope you, our listener, are thinking about family members, friends, neighbors that could just use maybe an extra pair of hands. We know 92% of our older adult population want to age in place. We also know not everybody can, but if you can, that would be an incredibly rewarding experience. And for me, I've been at the helm at Cypress now for 14 years, and I got to see, before I even joined this company, the work that these unsung heroes do every single day. So this tribute is to my mom. Happy birthday. It's hard to believe you've been gone 15 years, but we miss you, and the banner still flies, and the message and the work that we do every day is really in tribute to you. So, I'm off my soapbox. I want to talk about Health Futures and what we do here. And in Health Futures, we bring to our listening audience information about how our older adult population can live a healthier, happier life. And how do we do this? We do this by bringing extraordinary guests. And today's no different. I have 3 extraordinary guests here in the studio. I've got just to my right, I've got Kathy Rood. She is with Jewish Family and Children Services, and she is the manager of Jewish Social Services for JFCS. Welcome to the show.
Thank you, Bob. Thank you for inviting me.
It's good to have you on.
Here. Thank you.
And you're going to hear a lot from Kathy in the second half, but she will, I'm sure, contribute throughout the show. So this first half is dedicated to our theme for this show, and that is it is Colorectal Awareness Month, and I have brought on the show a medical director from Optum Care Network of Arizona, and his name is Dr. Ken Cable, and he is board certified internal medicine. And welcome to the show.
Thank you, Bob. It's great to be here.
And it's great to have you on the show. A little closer. And to his left, or his right, my left, is Angie Netto. And she's the marketing manager for Arizona. Welcome to the show.
Thanks. It's good to be here, Bob.
So I want to go over to you. Can I call you Ken?
Absolutely. Please do.
Ken, hold on one second. We're having some technical difficulties with your mic, so let's swing Angie's mic over just real quick so that we can actually hear you there.
Is that better?
Oh, it's much better.
Okay.
It sounded like you were in a fishbowl. So the engineers are going to work on the mics, make sure they work. But, Ken, let's talk about colorectal cancer awareness month. As I understand it, colon cancer is one of the most preventable cancers there is.
It's a very serious problem, Bob. It is the #2 cancer killer in the United States, and approximately 800 people will die in Arizona this year from it. However, if it's caught early, it can be cured. In fact, 90% of people are cured if it's caught on a screening examination.
Perfect. 90% are cured.
That's right.
And tell me about what one has to do to get screened.
There are many options for screening. The best is colonoscopy. And I want to tell you a personal story in that I turned 50 recently, and I underwent my first colonoscopy this week.
You just did it this week?
I just did it on Tuesday. And
wow.
It was not bad at all. It is painless. I have no memory of the actual event. The day before, you have to drink a clear liquid diet, which was a little bit difficult, but otherwise the prep was not bad. And you certainly should not put it off because of fear of the test.
So I just had it done at the end of last year, and the prep is very different now. Did you do the prep kit?
I did.
Because the prep kit is simple compared to what you used to have to ingest.
It's 5 ounces of liquid the night before, followed by approximately 40 ounces of water, and then 5 ounces in the morning, followed by 24 ounces of water. It's a piece of cake.
Wow. So, I mean, in terms of screening, obviously that's probably the gold standard, having a colonoscopy. But what can you do even beforehand? Is there blood tests that you can do? Get your PSA checked? I mean, tell me other things that could lead up to without having a colonoscopy.
There are other mechanisms for screening. For example, we can look for stool, or look in the stool for blood.
Okay.
And there are different mechanisms to do that. We can also do X-ray procedures. There's something called an air contrast barium enema, where they're able to look at the colon and get a good view. And there is a stool DNA test called Cologuard that is available for people between the ages of 50 and 84, as long as they don't have any elevated risk factors and they don't have any symptoms.
So if you have a family history, obviously you want to go before you're probably 50. Doctors sometimes recommend maybe 40, 45 if you have family history.
That's right. If you don't have a family history, the recommendation is 50. If you're African American, it's 45.
Okay.
If you have a family history, you should talk to your physician about it, because you might have to be screened even in your 30s, depending upon the age at diagnosis for your first-degree relative.
And you just had it done this week, so did you get a hall pass for another 5 years?
I did.
So did I.
I'm very pleased with that.
Isn't that great?
It is.
And, I want to talk about the exam itself, because there are things that they look for. And I just know this having gone through this. They're obviously looking for polyps. They're looking for, a number of different things there. And when they do that procedure, they can actually, harvest those things and biopsy them and take a look at that a little bit further, right?
That's right. And that's the other screening tests often lead to a colonoscopy, because the colonoscopy can actually treat you. If you have polyps, they can lasso them and laser them off and remove them. And then they look at them under the microscope to be sure there isn't any cancer in there.
Wow. That's incredible. Now, you talked about blood in the stool. And I have enough knowledge to be dangerous. I mean, the blood in the stool typically may not be red. It might be black, right?
It can. So digested blood turns black when it comes out. But even more often than that, it's microscopic. You can't even see it. So the tests can detect it before it's even visible.
Wow. That's really, it's interesting. And, here it is. It's the awareness month for colorectal cancer. You just had it done this week. Obviously, you just turned 50, so welcome to the club.
Thank you. It's good to be here.
And you know what? For us, and what we're trying to do here with our show is to draw this awareness and know that getting screened is so important. It is, like you said, one of the most avoidable cancers if you get proper screening.
That's correct.
And you said how many people will pass away this year?
Close to 1,000 will pass away in Arizona from this disease.
That's incredible.
And probably 90% of that is preventable.
90% is preventable. So
if people are screened.
Listen up. I mean, look, the thought of having one of these done isn't exactly what makes your day. The dentist is probably something you want to go to before you have this done, but it's something you need to do.
Absolutely.
And our engineer, listen, he brought on a little St. Patty's music to get us all primed up for next Friday, where everybody will be Irish. So if you're just tuning in just now, we aren't the Irish Network. We're Health Futures, taking stock in you. And I am pleased to have JFCS in the studio. I got Kathy Rood, who's the manager of Jewish Social Services. And I've got Dr. Ken Cable, the medical director of HomeCare, Arizona. And just to my left, his right, I've got Angie Nedow. And we're going to hear a little bit more from her when we come back from a break. You're listening to Health Futures, taking stock in you. We will be right back.
Today in Wall Street, markets are down big. CEOs and business owners are in full panic mode.
That's because they don't know where to buy quality, affordable office furniture. Markets West is the answer. Whether your office is large or small, you always get excellent service and great prices at Markets West. Locally owned and operated for over 38 years. Their experienced staff meets with every customer to help design and deliver the perfect office environment for you and your staff at an affordable cost. From desks and executive chairs to cubicles and reception area furniture, they have everything for your office furniture needs. Want to save even more? Mention Money Radio and get wholesale pricing. Markets West Office Furniture, your source for new and used office furniture. Visit them online at marketswest.com. That's markets with an S, west.com, or call 602-275-2226. Save time and money. Call 602-275-2226 today.
If you've ever thought about investing in real estate, but you haven't because you just aren't interested in the typical hassles and headaches of real estate, then don't touch that dial. For over a decade, Investment Property Experts has been helping investors take advantage of the growing Metro Phoenix real estate market through a unique offering of turnkey real estate investment services. Investment Property Experts eliminates the hassles and headaches by providing a full inventory of single-family homes that are fully renovated and occupied with tenants. IPX manages the property for you during the time you own it, and when the time comes, they can help you get it back on the market and facilitate the sale, all at no additional cost to you. And if you'd rather not purchase and own investment properties, Investment Property Experts offers a 9% return through deed of trust investment programs. Real estate market conditions in Phoenix have never been better. And with Investment Property Experts on your side, you'll be able to diversify into profitable real estate investments right from day one. Investment Property Experts, your true one-stop shop for real estate investing success. Get started by visiting azipx.com.
The madness is on. You still have time to play in the Corona $1 Million Bracket Challenge at MoneyRadio1510.com. Prizes at every round. Play and get it now at MoneyRadio1510.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and I've got three individuals in the studio today. I have got Kathy Rood. She's the manager of Jewish Social Services with JFCS, and that is Jewish Family and Children's Services. I have got Dr. Ken Cable, the medical director for HomeCare, Arizona, and I've got Angie Nedow, and she's the marketing manager for Arizona. Nedo, thank you. Angie Nedo, like Meadow, thank you. I got it right. I would like to just finish up a little bit about colorectal cancer month, and I really want to talk about some of the risk factors. We know about the exam and what should be done, and we also know that if you have family history, you're looking at 45. If you're African American, you're looking at 45. If you get a clean bill of health like you and I have, you get a hall pass for another 5 years. So tell us about some of the risk factors to colon cancer.
There are modifiable risk factors for this, Bob. If you smoke or drink excessive alcohol, you're at increased risk for colon cancer. Also, your diet plays a large role. You want to eat a diet that's high in fiber. You want to watch out for processed foods and red meat, because that will also lead to an increased risk of colon cancer.
Wow. I mean, so diet is a big contributor.
It is that. You can imagine the food passes right past these cells that will eventually become malignant. And we don't know at the microscopic level how it happens, but we know it's a risk factor.
And we also know that, they diagnosed me as having mild diverticuli. And diverticuli is caused how?
Those are outpouchings of the colon. That's not related to colon cancer.
Okay.
But they can be dangerous because they can get clogged up and cause pain, or they can actually bleed.
Yeah, and I do know that. I have family history on that. So I know like nuts and seeds and stuff like that can develop in those pockets, and you got to be really careful.
That's correct.
And again, it goes back to diet.
It does. Diet is so important. Also, keeping yourself in good shape. You don't want to be a couch potato. Exercising, keeping yourself thin, all helps prevent colon cancer.
And drinking a lot of water, right?
Yeah,
water's always good.
Drinking water is helpful, sure.
Well, I've got some water in here, and it's a little warm out. I mean, it's Arizona, and here it is March 10th, and we're looking at like 90 degrees today. Kathy, do you have any comments at all before we learn a little bit more about HomeCare?
So actually I do. So I was actually having a conversation about this with my mom just like 2 days ago. And she asked me, have I had a colonoscopy yet? And I said, no. Well, I just turned 52 in September. And she said, well, you're 2 years past due. You need to go have that done. And I said, well, Mom, I'm a woman. I thought it was different for women than it was for men. And she said, I don't think so. I said, well, I'm going to check that out. And here we are 2 days later. I think I'm going to get my facts straightened out for me.
Do you want to talk a little bit about that, Ken?
Kathy, Mom was right. It does not discriminate based on sex.
So men and women should get screened.
Absolutely.
Well, you know what? I want to pop over here to Angie Netto. I got it right. She's the marketing manager for Arizona for HomeCare of Arizona, and I want you to really talk to us a little bit about what is HomeCare, because the only thing I really think of with HomeCare, it's a Medicare Advantage plan.
Right. So it's a big question. Most people, if they haven't heard of HomeCare, they have the same question. And actually, HomeCare is a network of providers and physicians, hospitals, specialists. So we're actually not an insurance plan. So we work with and partner with insurance plans to help deliver those benefits. So
see, I didn't know that.
See, here we are learning something today. So really what happens is when someone chooses to become part of a Medicare Advantage plan, if they choose a plan we work with, and once they do choose that, then they're asked to choose a primary care physician. And if that physician's in our network, they're part of the family. So they become part of the HomeCare network. And then we really get to, to engage with that person and help them to, navigate the healthcare system, really.
And, one of the biggest challenges we have in our country and in our communities is that the word healthcare is probably the biggest oxymoron going, because it really is sick care. And, I know enough about Optum to be a little bit dangerous. HomeCare of Arizona does it a little bit different because you are really working on the wellness of your members. And I want you to share with our listening audience as to some of the things that you are doing at HomeCare of Arizona.
Right, and you hit it perfectly. I mean, we really want to focus on that holistic health approach, and some of the ways that we do that is by providing places for folks to go to stay in front of their health, so to stay active, to educate themselves on healthy topics. So a perfect example, we have these beautiful community centers around the valley. We have 3 separate locations, and each location has just beautiful fitness studios where you can go and you can work out, do circuit training. We have staff there that is trained specifically to help folks that are in that 55 and older community learn how to appropriately get a good workout, strengthen their bodies with within a safety net, so to speak.
So I got a question for you.
What's that?
So being a member, you get to do this at your communities, the 3 community centers.
Absolutely.
Is there a gym membership that comes along with it? Or is that part of it?
And you want to know
so you can cancel your gym membership.
You sure can. Cancel it and come tomorrow.
and you've got fitness trainers and coaches there to help you.
We do.
You don't have to pay extra for private?
No, and the great part about it is this isn't exclusive to OptumCare members. So if you are part of another plan or if you're not an OptumCare member, you can come as well. This is open to the community at large.
I love it.
Because we really want to have that positive effect on the entire community. And so it's not just about fitness. You can come in for art classes. You can come in for, just social engagements. We throw great parties.
And where are the locations?
So we do have our flagship location is in Phoenix. It's off of 27th Avenue, about the 101 and the 17. Thank you.
Right.
And then we have a new location in Chandler and a new location in Goodyear as well.
Wow. And I also know my friend Dr. Paul Bentheim does a Brain Saver program, and I know he does the one in Phoenix. Does he do them in all three?
So, yeah, actually, he's taken the time to train our staff. So our staff is now an extension of Dr. Bentheim, and at all three locations offer a Brain Savers class, and it's fantastically popular. And it's, all three locations, you can take part in that class.
Do you have to be 65?
You don't. We're not going to card you at the door.
You're not going to card us.
No. All of our programming is really geared towards that 55 and older age. But, we're not. If you want to come in and you're a little younger than that even, you'll still get a good workout or there's something interesting for you to do.
Even Dr. Ken Cable, he can get in. He's just turned 50. He's
come
got
on down.
He's got a little snow on the roof.
I bet one of our coordinators would love to get you through some circuit training,
I'm
Dr.
ready.
Cable.
As we wind down the second segment, and it's hard to believe these segments go by really fast. I want to just look to you, Angie, and you, Ken. What parting comments can you share with our listening audience?
Well, I'd like to say that if you're worried about getting your colon screened, don't be. It really is an easy procedure, and it can save your life.
How about you, Angie?
If you'd like to take advantage of some of the offerings at the community center, check us out at optumcare.com/Arizona, and you should be able to find some interesting things to look for. And
do you have a phone number too?
We do.
I have a number here. Let me know if it's right. 866-339-3755.
That's perfect.
And you're going to reach their general call center service team and just ask for OptumCare Service Advocate.
That's right. And they can answer just about any question that you have about the community centers or about OptumCare in general.
So I'm going to ask one final question. Open enrollment's a big deal with Medicare. And does that also apply to Medicare Advantage plans?
Yes, it does.
Okay. And I know you can work out and participate in the community centers if you're not even a member of OptumCare. But to be a member of OptumCare, you have to, if you're not a part of it now, you have to wait to open enrollment until December, right?
It's in October is when it starts. Yep. And so that would be when you can make a change into your Medicare plan. Or if you are 64 turning 65 outside of that October timeframe, then you can also choose a Medicare Advantage plan if that's what you choose.
And you can learn so much at that website that Angie Netto just described. That's optumcare.com, and that's optumcare.com/Arizona. And you can learn about the plans, you can learn about the activities, you can learn about just about anything related to OptumCare. Well, Angie Netto, thank you for being here on the show.
Thanks for having me.
Dr. Ken Cable, thank you for being here
Thanks,
on the
Bob.
show. And thank you for bringing awareness to such a really important issue, and one, like you said, is preventable. Get screened.
That's right.
It's not that bad. Hard to believe it's halftime here at Health Futures. We're going to take a break now. We'll be right back.
As we reach the bottom of the hour, we pause for a look at the world's news. Then we're back with Money Talk. We're Money Radio 1510 AM and 105.
Will it be Obamacare repeal, replacement, or reform? Whatever it may be, President Trump says they're moving ahead.
This is the time we're going to get it done. We're working together. We have some great results. We have tremendous spirit.
The president today before his meeting with House committee chairs working on changes to the Affordable Care Act. President Trump was quick to retweet today's unemployment report.
Let's look at the unemployment rate, 4.7%, relatively steady. When I look inside these numbers, I see people coming off the sidelines and into the labor markets, and that's a good thing.
Correspondent Christine Romans in New York. Wildfires in Kansas are winding down. Fire crews now going home. Last weekend saw big blazes around the Midwest. They've been talking about it for more than a year. Now it's apparently a done deal. Pope Francis will visit Colombia in September. Author Robert James Waller, who wrote the 1992 love story The Bridges of Madison County, has died. No word yet on a cause. He was 77. I'm Rich Johnson.
Are you My number 2 does not look like a number 2. I don't know what to call it. Is there a number 3?
Table for 4, please. Anything close to the restroom.
A middle seat with these stomach problems? That's my fear of flying.
Sound like you? If it does, you could be one of the many people with a digestive condition called exocrine pancreatic insufficiency, or EPI. Even if you don't know what EPI is, you might know the symptoms: frequent diarrhea, gas, bloating, stomach pain. If you have even just one of these symptoms, you could still have EPI, because not everybody experiences EPI the same way, which is why it's so important to open up to your doctor about all your symptoms. And the good news is, EPI is manageable, so don't keep a lid on it. Go to identifyepi.com, complete the symptom checker, and use it to have a conversation with your doctor. Don't keep a lid on it. Visit identifyepi.com. Brought to you by
The leader in business news is the station you can take with you wherever you go. Get the Money Radio app for your smartphone and stay connected.
Hi, this is Geraldine, owner of Z Cleaners. You may have heard that Z Cleaners is Arizona's only certified couture care specialist. But what does that mean? It means we are required to complete specialized training, pass the toughest cleaning standards in our industry, and we are inspected at least 5 times a year by America's best cleaners. To care for your designer or bespoke clothing, choose the only certified dry cleaner in Arizona. Give us a call today at 602-CLEANER or visit us online at zcleaners.com. Z Cleaners, excellence always.
OneTap, the leader in mobile apps, is growing and needs to hire over 20 outbound sales representatives to promote, sell, and retain business in Arizona. OneTap is looking for detailed-oriented, motivated individuals to join their team in Phoenix. Full and part-time positions are available right now. Full-time employment includes excellent benefits, high commissions, vacation days, and incredible resources and services to set you up for success. If you have exceptional service skills as well as PC and date entry proficiency, call 480-498-8300 or visit them online at onetap.net.
Are you struggling with stubborn, unwanted fat? Are your clothes not fitting the way they used to? Cool Sculpting is the way to go. Check out the world's leading non-invasive fat removal and body contouring treatment. Cool Sculpting at Scottsdale Center for Women's Health and Vitality Men's Health frees away unwanted fat for good without surgery or downtime. During your free consultation, we'll customize a plan for you. Cool Sculpting at Scottsdale Center for Women's Health and Vitality Men's Health. Call today, 480-425-8702, or visit vitalitycoolsculpting.com.
Arizona is rolling out the voluntary travel ID, which complies with the Federal Real ID Act. You'll need it for air travel and to access federal and military facilities. But there's no rush to get one. Your current driver license or ID is good until October 1st, 2020. The cost is $25 and it's valid for 8 years. To learn how to get your voluntary travel ID and the documents you'll need, visit azdot.gov/travel ID. Sponsored by ADOT in partnership with the Arizona Broadcasters Association and this station.
Are you hiring? Join the over 3 million businesses that use Indeed.com for hiring. Post your next job opening on the world's #1 job site, Indeed.com.
I'm Bruce Vail with Your Money Now. The horror video startup Crypt TV has raised $3.5 million through a round of funding. The company produces short, creepy videos that have built a following of over 2 million Facebook fans. With the new funding, Crypt TV plans to build on some of its popular characters and recurring franchises like Giggles the Clown and Close Before Midnight. It also aims to produce more serialized content and longer videos. MGM Holdings is nearing a deal to buy out its partners, Viacom and Lionsgate Entertainment, and take sole ownership of the pay TV channel Epix. An agreement valuing Epix at a little more than $1 billion could be announced as early as next week. A strong February jobs report has stocks in positive territory. The Dow Jones Industrial Average is up 22 points. The Nasdaq Composite is ahead 13 points, and the S&P 500 is up 4. That's Your Money Now.
How's that kitchen remodel coming along?
I haven't found a reliable contractor and have no idea where to start.
What about HomeAdvisor?
Home what?
Home Advisor. They match you to pre-screened and top-rated pros for any kind of home project. You can even check pricing and book appointments online.
What's the catch?
No catch. Home Advisor is completely free to use.
Really? I'll check it out. Go to HomeAdvisor.com or download the free app.
Home Advisor. You can't see me because of radio, and I can't see you because I'm totally blind. My blindness doesn't hold me back, but I fight to stay awake during the day because I'm not sleeping through the night. I often struggle to concentrate and just keep up. Sound familiar? You're not alone. But this is not a sleep disorder. It's actually non-24. Learn more about the link between total blindness and your symptoms. Visit learnmore924.com today or call 844-368-2424. Sponsored by Vanda Pharmaceuticals.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you, and I'm your host, Bob Roth. And we are on our third segment. And it's hard to believe that two have already just flown by. If you missed the first two, you can catch them up on our website at cypresshomecare.com. And the first two segments, we centered around talking about OptumCare Network of Arizona. And we were really focusing on talking about colorectal Cancer Awareness Month. And that is what the month of March is. And the one message that we all heard loud and clear from Dr. Ken Cable, this is one of the most preventable cancers out there, so go and get screened. If you are at high risk, you have family history, or if you're African American, start at 45. If you don't have either of those, start at 50, and if you get a clean bill of health, every 5 years after. And if you did listen to the first two segments, you did hear that Kathy Rood from Jewish Family and Children's Services is here. That's actually Jewish Family and Children's Service is here in the studio. She's the manager of Jewish Social Services. So, Kathy, welcome to the show.
Thanks, Bob.
It's good to have you on the show. And, you know, I had the honor about a year and a couple months ago of having your former president and CEO on the show. And he was a dear friend of mine. And unfortunately, we lost him to a early death, Dr. Michael Zent. An incredible man, and did so many wonderful things for Jewish Family and Children's Service. And it was wonderful to have him on. And I paid tribute to him a couple weeks ago and did a best of, because he has done so much for Jewish Family and Children's Service. I mean, you guys, under his tenure, probably grew almost threefold. And it was through his leadership that you guys are and have become what you are today. How many years have you guys been in the Valley?
So JFCS started about 82 years ago.
82 years ago.
82. And when we began, we were actually a sectarian agency. So it was started during the Depression by a group of women, Jewish women, that wanted to offer social services to poor and needy Jewish families and also Jewish elderly that lived here in Arizona. I mean, I think our entire Jewish community was about 1,000 at that point.
That is incredible.
I know. It has grown.
But you think about how giving they are. And I find that, you know, I'm Jewish and I know you are as well. I find that something that is deeply embedded in us culturally. And even during as difficult a time as that was for our country and for our people, that people came together to help their fellow brothers and sisters. And like you said, it's non-sectarian. I mean, you serve all faiths, all colors, all creeds.
Yes, we do.
It's amazing.
Yes, we do. I think that JFCS is probably one of the largest behavioral health organizations in the Valley to date. And I think, like last year, I believe we served in some fashion over 58,000 people.
58,000 people.
Yes.
You know, and I talked to the OptumCare folks, and they have community centers across the Valley. I know JFCS does as well.
We do. We have 4 behavioral health clinics. One of them, actually, the one in Maryvale, it's our Michael Arzent Clinic, and it is actually a wellness center. It not only has behavioral health for counseling, for psychiatric care, but there's also a doctor in there, a pharmacy in there, so we can try to treat the whole individual.
Well, I'll tell you what, my connection to you guys goes back a long way. I talked about my mom at the top of the show, and my mom used to serve on several of the committees for JFCS, and it goes back over 30 years. And for me to see the growth that I have seen and the people that you've helped is nothing short of phenomenal. And that special tribute show that we played here on this program was the same day as the Brighter Tomorrow Luncheon. And I must tell you, there was over 560 people that were there. They raised over $300,000. And the guest speaker was amazing.
Yes, he was.
Amazing. I mean, one of the things that you guys do, and you talked about it before, is behavioral health. And you guys do an amazing job with fostering kids, or with foster kids, and helping them find places that are safe for them.
Well, they do more than that. You know, there are a couple of programs that provide services to foster youth and also at-risk youth. And those programs are really there to help these kids, these budding young adults, learn life skills, social skills, employment skills, so that they can be independent in their lives.
And our guest speaker was one of those that went through a similar program. Wasn't the Jewish Family and Children's Service program, but very similar. And here he is. He is the executive director of a foundation, probably one of the largest here in the Valley. So, you know, when you can get help and you can use services like JFCS, these children that are at risk can thrive and grow. Yeah. And it's amazing the work that the organization does. Yeah. So I'm going to pivot.
Okay.
I'm going to talk about older adults.
Oh, good.
Because that's my space and that's your space.
That's kind of my space too. Yeah.
And that's why you and I have known one another for years.
Yeah, exactly.
You know, I have a great affinity for helping our older adults
As
age.
do I.
And you know, when I said in our last segment, 92% of older adults want to age if they can in place.
Absolutely.
And you know, there are three things that have to happen to have people successfully age, and that is socialization is one of the keys.
Key.
And when you look at almost a third of our population, 65 and older, are living home alone, that's a problem. Yes. That's a big problem. The other part is, you know, part of socialization is eating meals. And we have a lot of our older adults that are living right here in our community that are missing meals, that are eating stuff that isn't highly nutritious. If they are suffering from a disease or an ailment like dementia or Alzheimer's, they're not purposely missing them. They're just the brain and the stomach aren't wired, and they think they've eaten and they haven't eaten. True. So losing weight is a big deal for our older adult population.
It absolutely can be.
Especially with women with osteoporosis. I mean, that is a big challenge. And then the other thing is medications. You know, taking the right medications at the right time in the right doses. So, as you know, I'm very passionate about older adults, but I want to turn the mic over to you so you can tell our listening audience about the work that JFCS is doing in this area.
Okay, thanks. Yeah. So you know that we do have social workers, caseworkers, counselors that go into the home. They go into the home of an older adult to do assessments. They do very thorough assessments to find out how a person is getting along, how they're performing, their activities of daily living, and if there are deficits there, if there are unmet needs, we do our best to help match them up with the services that they need and get those needs met.
Right. And that is so important. I mean, I look at you guys, and correct me if I'm wrong, you're navigators.
Well,
you're helping these families get to the right solution.
We do that. We also provide counseling if that's a need. But, our goal, Bob, is to really help people live as long and as independently as possible in their own homes as they can.
And that should be all of our goals. They should be able to do that. One of the things that our listening audience loves, and I mean, I know you've got tons of stories.
A few.
We have just about a minute here, but can you tee something up? And maybe we can talk a little bit more about it in the second segment of some of the work that you've done.
Certainly.
All right. So, You can change the names of the family members and the situation, but give me a scenario that you just experienced recently. I'm now putting you right on the spot.
Oh, thanks. Because my recall is so good.
No, but you do so many great things for these families, and a lot of times the calls you get aren't necessarily from the individuals themselves.
No.
It's from the adult children,
That's
the
right.
neighbors, the friends, clergy.
A big part of my job is information referral that happens over the phone, through email, but mostly over the phone, and I get a lot of calls from adult children. And these calls range from what I would call the low end of the spectrum. So their parents are aging, they're independent still, but they're trying to kind of plan for the future, all the way to the other end where their parents are, they've been diagnosed with Alzheimer's, dementia, and they're failing in their homes, and they just don't know where to go or what to do. So basically, I worked very hard at trying to be empathetic with these callers and to hear where they're coming from and to help them to navigate or to provide guidance for them on how to better work with their parents. And if there are services that we have at JFCS, that's fantastic. If not, then I help direct them on where to go to get their needs met.
No, I love it. And especially the services, as you described earlier, the counseling services and intervening and helping those older adults that are failing or being challenged.
Yeah.
Well, we're going to go out on a break here with Bruce Springsteen. Thank you, James. It's hard to believe that we're 3 segments down here on March 10th, and we're wrapping up our show in the 4th segment with Kathy Rood. She is with Jewish Family and Children's Service. She's the manager of Jewish Social Service Programs. And when we come back, we're going to talk about older adults, and we'll talk about some of the great work that you guys have been doing for 82 years in our community. It's end of the 3rd segment. We'll be right back.
Hey, Corey Scheidler here from Core Fitness. Guess what's right around the corner? That's right, swimsuit season. And you know what that means. It's time to start shedding that winter weight. But no worries, though, because I'm here for you. I've developed a new program called the Core Fitness Project, and right now I'm beta testing it. It's completely free, and I want you to try it. Go to www.corefitnessaz.com, and I will show you exactly how to get a strong, sexy core. That's www.corefitnessaz.com, and we'll get started today.
The new MBZ Scottsdale service is your affordable choice for quality Mercedes-Benz service. With over 20 years experience and 18 as a Mercedes-Benz Master Certified Technician, you know your vehicle is in good hands. Save money without sacrificing quality. Mention this ad and get 30 to 50% off dealership pricing. MBZ Scottsdale Service is located off of Scottsdale Road, north of the 101. MBZ Scottsdale Service, 480-473-4722. Ask about their VIP pickup and delivery service. MBZScottsdaleService.com.
Hi, I'm Johnny Dean.
And I'm Rick, the Professor Plum.
Every day on Bucket Strategy Investing, we're talking about financial planning, investment decisions, and retirement strategies.
We focus on wealth education and the strategy designed for the needs you have today
and the goals you have for the future. Tune in to Bucket Strategy Investing.
And call in with questions.
Retirement strategies, taxes, Social Security, and more. That's what we're talking about on Bucket Strategy Investing.
Liberty Mutual Insurance presents a story about Nana's cake.
It's Nana's 80th birthday, and you accidentally locked your keys in the car, along with her ice cream cake. No worries, this is a happy story. You have Liberty Mutual Insurance with 24-hour roadside assistance, and help is on the way. Liberty saves the day, and Nana even gives you an extra piece of unmelted cake.
Visit a local office or call 844-8-LIBERTY. You can leave worry behind when Liberty stands with you. Liberty Mutual Insurance. Optional towing and labor coverage. Underwritten by Liberty Mutual Insurance Company.
Are you hiring? Join the over 3 million businesses that use Indeed.com for hiring. Post your next job opening on the world's #1 job site, Indeed.com.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress HomeCare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. I'm your host, Bob Roth. And if you're just tuning in, we're on our 4th segment. If you missed the first 3, you can catch them up on our website at cypresshomecare.com. Click on the radio button and you can catch the first 3. The first 2 were with Optum Care Network of Arizona. And the last one, the third one, and this one is with Jewish Family and Children's Service. And I'm here with Kathy Rood, Manager of Jewish Social Services. So we're back. We're talking about older adults. Tell me a little bit more.
We are. So first, you've mentioned my title a few times, Manager of Jewish Social Services. It's a little bit confusing, although I do work a lot inside the Jewish community. A lot of our clients, especially our older adult clients, are not Jewish. But I kind of was hoping we could talk a little bit about a segment of the community that is Jewish, our Holocaust survivor community.
Please do. I know you have a great program.
We do. We have a wonderful program for the Holocaust survivor community. And the reason I'm mentioning this is because in the last 2 years, the number of survivors that we have assisted has grown exponentially.
And what are some of the programs you guys have? And I know that there's a program that is federally funded or funded by the German government. How does that all work?
Well, that's not specifically our program, but of course, the survivors in our community are going to be eligible for all of the other programs that we offer to seniors. But there are a few things that they are entitled to expressly based on being a Holocaust survivor, such as there are reparations through Germany. And so if there is a need for an application, we can help them with that. But there's also another entity in town, it's not in town. I take that back. But the Blue Card, so we help them apply for assistance with home care, for housekeeping that's paid for through these other entities.
And the interesting thing is, like anything else, when it deals with the government and bureaucracy, getting through all those applications is really challenging.
It is tedious.
And for our listening audience, if you know a survivor that could benefit from some of the programs that we're talking about for older adults, Jewish Family and Children's Service can help you through that process. They can help you fill out the forms and make those applications, right?
Yeah. Well, yes. And there's a new program that has come to Phoenix. It's a national program. There's a Jewish dental fraternity, Alpha Omega Jewish Dental Fraternity, and these folks, these dentists in this fraternity, they are offering free dental services to survivors around the country and in Canada. And Phoenix is the 18th city now to offer they are all coordinated through the Jewish Family Service agencies in their community. And so Phoenix is the 18th city. So we're very excited. So far we've had 5.
Nice.
Since October.
Nice. And
so it's moving.
And the hardest thing about it is, when we were younger, you thought that the Holocaust was an eternity ago. Yeah. And now, here we are, 2017, and there's still survivors. And obviously, it was an atrocious event that happened in our world, and one that we should never forget. But there are very few survivors anymore. They're going away, and we need to tell that story.
But if you think about it, it only happened just over 70 years ago.
Right.
Yeah.
Absolutely. So you take care of some survivors.
We have a lot of survivor clients.
I'd love for you to.
You want me to tell you?
Yeah,
okay,
tell me a story.
Okay.
Tell me a story about one of the survivors you're working with.
Sure. So one individual we've worked with on and off for several years. She has lost her sight, but she is fiercely independent and an absolutely wonderful woman. And I can say this about I am so honored to work with this part of our community. It just, it's an absolute honor to me and to be able to help these people. And I can also say that I learn so much from each client that I work with. But so this particular client, she has lost her eyesight, still fiercely independent, but she has benefited over the years through many of our programs. And it's so hard to talk,
Well, you know what, and I share that passion that you have, because I learn so much from our clients, and our older adult population has so much more to give. And it's amazing how, we as a society in our country here, in the past, we've treated a lot of our older adults as being disposable and putting them away. when they have so much left to give. And, agencies like Jewish Family and Children's Service and agencies like Cypress HomeCare, we get to touch so many of these people, and we get to learn about their lives. They're like a good book.
Well,
we learn so much from what they have to share.
We learn a ton from what they have to share, and not only do we touch their lives, but they touch ours as well.
Indeed.
And it's
So about some of the other programs, you have a Center for Senior Enrichment.
We do.
And I want you to talk a little bit about that. And I just heard recently that one of your called patron, one of the people that used to go there,
yes.
Ruth, passed away recently, and she was like 102 years old, and I remember being there present at the very first Brighter Tomorrow luncheon, and she that was 8 years ago, so she was like 94 at the time, 95 years old at the time, and I couldn't get the mic away from her. She was just such a spunky lady. But we only have about a minute or so left. I want you to talk about the Center for Senior Enrichment Program. It's an amazing program.
It is an amazing program. Our Center for Senior Enrichment is located inside the Palazzo, 19th Avenue in Maryland. Its opening. Its hours are 9:30 to 2:30, Tuesday through Friday. They offer amazingly enriching activities. Throughout those times. There's also lunch available there, and even though it's inside a senior community, it's open to all seniors, which was very important. Yeah, and I also want to mention we have another person on board, our senior concierge, and she's wonderful, and she's starting these creative aging classes, and oh man, they have become so popular so fast. There are classes like dance. There's reader's theater. I said, what is reader's theater?
Right.
So basically you're acting out a play with the script in your hand, and it's so much fun.
And they're doing these across the valley. They're doing it over at the Palazzo. They're doing it at the JCC. You're doing it in communities.
She has several different locations. And you know what? I'm gonna hope we can give out her number so people can call for more information.
And that number is?
602 599 7198.
7918.
7198.
I'm sorry, 7198.
Yeah.
And you said 602. I have that on the
480.
480. 599 7198. Kathy Rood.
Can I give out my number really
Please,
quick?
give your number out.
Okay, 602-452-4627. If you have any questions about our older adult programs or Jewish social services, please, please, please give me a call.
Thank you, Kathy, for being on the show. Make it a great day. Have a great weekend. We'll be on next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress HomeCare Solutions at 602-264-8009. That's 602-264-8009. Or visit CypressHomeCare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.
$1 million plus a big screen HD TV. Fatheads and Twin Peak restaurant gift cards are all up for grabs just by filling out a Corona bracket at MoneyRadio1510.com. The Corona $1 Million Bracket Challenge gives you 3 chances to win: the full bracket game, the Sweet 16 bracket game, or the Final Four bracket game. You can even grab some great prizes just by winning one round. The madness is here, and you have until 15 minutes prior to the first round of games to fill out your brackets. Money Radio is hooking you up. Get your free bracket now at MoneyRadio1510.com.
Money Radio 1510
and 105.3 FM
is KFNN Mesa Phoenix and K287BX Mesa. Tap the Money Radio app on your smart device and boom, there we are. You might need to make a visit to the App Store today. The Dow is up 35 points at 20,893 right now. The S&P is up 5, 2369. NASDAQ up 14 at 5852.
When people want to talk about money, this is the place they come to. And there's more on the way after this break for the latest news. And we begin